If you've noticed that you no longer wake up with an erection, know that this change could be directly related to your health. This isn't just a minor detail or something. Irrelevant, in fact, the absence of these morning erections could be a sign that something isn't working properly in your body. My name is Anori. I'm a urologist, and in this video, I'll explain the 4 main causes that could lead to the loss of morning erections. We'll discuss factors that affect hormone production, blood circulation, sleep quality, and even how stress can sabotage your performance. All of this will be presented in a simple and straightforward way so you can understand what's happening and how to take action to restore your intimate health. If you're looking for solutions to this problem and want to improve your quality of life, stay with me until the end of the video. Before we continue, make sure you're subscribed to the channel. That way, you'll have access to more videos with valuable information about health and sexual education if you find this content helpful. Hit the like button so more people can access these important tips. And we'd love to hear morning erections. Your thoughts, leave a comment with 1 if you found the topic interesting, or 0 if you have suggestions for improvement. Your feedback is essential. Many people get worried when they realize that their morning erections have stopped. It's not uncommon for someone to seek help saying something like, "I don't wake up with a hard penis anymore, is this normal? Is something wrong with me? Should I be concerned?" This question is more common than it seems. But before you panic, let's clear this up. Morning erections play an important role in male health, and to start, let's make one thing clear. This type of erection has nothing to do with needing to urinate. Forget the idea that waking up with an erection only means your bladder is full. The explanation is completely different and is directly related to the vascular system. If you're a regular viewer of this channel, you know that sexual health is a topic we take seriously here. And if you're new, welcome now. Let's take a look at how erections work. The process is simple but fascinating. The penis has 2 structures called corpora cavernosa, which act as chambers capable of filling with blood. When this happens, these chambers compress the veins, preventing the blood from flowing out quickly. This mechanism ensures a firm and longer-lasting erection. Understanding how this works is the first step to taking care of your intimate health. If your goal is to have a healthier and more satisfying sex life, check out my digital book. Rediscovering Intimacy, Healthy Sexuality After 60, this practical guide provides strategies to strengthen relationship bonds, deal with REM sleep, physical and emotional challenges, and reignite passion and connection. To get your copy, just click the link in the first pin, comment. Don't miss this chance to transform your love life. Morning erections have nothing to do with a full bladder or the urge to urinate. Instead, it's all about the vascular system during sleep. The body goes through cycles, and in one of them, known as REM sleep, important changes occur in the body. REM sleep, which stands for rapid eye movement, is the stage when dreams are more vivid, but it's not just for dreaming. During this period, the body releases hormones like testosterone and increases the production of nitric oxide, a substance that helps relax blood vessels with higher levels of testosterone and relaxed blood vessels. Blood flow to the penis increases, resulting in erections during the night. This process is natural and occurs multiple times throughout sleep, typically 4 to 5 episodes. So waking up with an erection is a sign that your body is functioning well and has gone through these hormonal cycles. It's a healthy physiological response and part of your body's balance. If these erections stop happening, it could be a sign that something needs attention on. But most importantly, understand that it's all connected to blood circulation and hormonal balance. After learning that erections depend on blood flow, let's causes of morning erections talk about what can interrupt these morning erections. One of the most common causes is a drop in testosterone production. This hormone is produced in the testicles and controlled by a gland called the pituitary when something interferes with this process, such as problems in the testicles or the pituitary gland testosterone levels, may decrease as a result. Both nighttime and morning erections may become less frequent. Another important point is the health of the heart and blood vessels, since erections depend on efficient blood flow. Any issue that affects circulation can cause difficulties: a sedentary lifestyle, obesity, diabetes, uncontrolled high blood pressure, smoking, and even the buildup of fatty plaques in the arteries can impair blood flow, and consequently, the ability to achieve erections. Finally, it's impossible to ignore the quality of sleep. The REM sleep phase, the stage when dreams occur, is essential for the production of testosterone and nitric oxide, a substance responsible for relaxing blood vessels. This sleep cycle lasts about 90 minutes, and to maintain hormonal and vascular balance, it's ideal to complete at least 4 cycles per night without proper sleep. The body doesn't have enough time to go through these essential phases, and morning erections may stop occurring. Poor sleep can completely disrupt the body's balance. Short nights with only a few hours of rest interfere with hormone production and reduce the vasodilation peaks that ensure morning erections. To illustrate stress, think of a busy period, like when you have small children at home. Staying up all night or sleeping only 3 or 4 hours in a row is enough to harm the quality of REM sleep, and as a result, affect erections. But there's a modern villain that deserves special attention: stress. We live in a fast-paced world full of pressure and worries, and this has a direct impact on sexual health. High levels of stress and anxiety trigger the production of cortisol and adrenaline hormones that keep the body in a state of alert. The problem is that this internal agitation makes it difficult to relax enough to enter deep sleep and reach the REM stage without REM sleep. The body loses the ability to produce testosterone peaks and release nitric oxide substances that are essential for nighttime and morning erections. In other words, if stress and worries aren't managed, sleep quality declines, and along with it, morning erections may disappear. High levels of adrenaline and cortisol, especially during times of stress or anxiety, can directly affect morning erections. And that's exactly what we're discussing today. We've already talked about some of the main reasons behind the absence of these erections. And yes, this is a topic that deserves attention when a man notices that they have stopped happening. It could be a sign that something needs to be investigated, but don't worry, there's no need to panic. It's important to look at the bigger picture. If your sex life is active, your libido is good, and you feel well, there's no need to turn the lack of morning erections into a bigger problem than it actually is. Sometimes the body just needs a little time to adjust. The key is to pay attention to how you feel daily. If you have energy, desire, and motivation to handle your routine, there's no immediate reason for concern. Relax, take care of your overall health, and if something seems out of place for an extended period, it's worth seeking professional advice to evaluate what might be happening. Throughout this video, we discussed the 4 main causes that can lead to the absence of morning erections, from low testosterone levels to problems with blood circulation, the negative effects of stress and poor sleep habits. All of these factors directly impact male sexual health, especially for those over 50. Now I want to hear from you. Which of the factors mentioned caught your attention the most? Was it the connection between REM sleep and hormone production, or the impact of stress on sexual health? Share your thoughts in the comments. Your opinion is very important. If this content provided you with helpful information, hit the like button. Your support helps spread these tips to more people who might be dealing with the same situation. And if you want to keep learning about male sexual health, check out other videos on the channel. I'm sure you'll find more relevant topics to strengthen your health and quality of life. That's it for today. I'll see you in the next videos. Take care.